Welcome to Kara's Cures, where we explore the leading edge of wellness. I'm Kara Sundlun. So what will the holidays look like this year with the pandemic? How can you safely celebrate? And what about young children who are not vaccinated? When can they get vaccinated? I'm joined by Eric Arlia. He's the Director of Systems Pharmacy at Hartford HealthCare. And he's got the latest on the guidance. Thank you so much for being with us, Eric.
Thank you for having me. Appreciate it.
First of all, can Thanksgiving look normal? I think that's what everyone wants to know. Can we just have people over and have a normal Thanksgiving? Or what are the guidelines? Let's start out with people who are vaccinated.
Sure. So, we continue to recommend that people follow the CDC guidelines. So currently that does recommend masking for anyone age 2 and above. I think we're going to be in an interesting period of time as we go through the holidays with the recent news of a pediatric vaccine for ages 5 to 11 coming out. I don't think we'll see the ability for children to be fully vaccinated by Thanksgiving, but if things go really well, and I can walk us through the timeline, for motivated individuals, I think there is a way to get children fully vaccinated before Christmas.
Okay, so originally there was some talk, will everyone be vaccinated by Thanksgiving? The latest information in the last few days would mean maybe not for those younger kids, and we're talking about under 12. Anyone 12 and up could get the vaccine by now, but what's the latest information on getting kids a shot?
Sure. So bear in mind, it's the Pfizer vaccine, and it's similar in that it's a 2-dose series spaced 21 days apart. So what we know about the vaccine now is that the FDA has set their hearing date for October 26th. But also remember that for vaccines to get full approval for use, the CDC's committee also has to weigh in on that. Right now, that meeting is scheduled for November 3rd. So what I'm seeing is that probably the first day that we would be able to give pediatric vaccines would be around November 4th. And that's assuming that there's no snags that come up along the way with the review process. The other thing that's changed, which we've learned in the last week, is that there will be a new formulation for children aged 5 to 11. The dose is 1/3 of the adult dose. So to make it easier to administer to children, Pfizer is developing a different concentration vaccine. So how does that impact the timeline and the holidays? We don't know yet exactly when we'll get the new pediatric Pfizer vaccine and how and what quantities. A lot of stuff has come out in the media the last few days. We know that the Biden administration has put a large order in for that vaccine, which is really promising. We had conversations last week with DPH, and they still didn't know for sure exactly how quickly we would be able to get supply. So right now, that's what we're watching very closely here in our system, and I know other providers in the state are watching as well.
So Thanksgiving, unlikely that you're going to have the young ones fully vaccinated, but as you said, maybe by Christmas. But let's just talk about how it looks. You say masking is recommended. I read recently the CDC is saying outdoors is preferred, but it's going to be a little chilly around these parts. So if you have to be indoors, they said maybe just putting a fan out, opening a window, airflow would be important. Not that we can't gather. Everyone's like, oh, are there any limits right now? Correct me if I'm wrong, but there aren't limits on the number of people you can have in your home right now. Just good advice.
Yeah, good advice. It's not quite like it was in 2020. I think as long as people use common sense, gatherings will be able to take place. I do think, many children will be able to have had that first dose by Thanksgiving, again, depending on how quickly we get supply and how quickly people are able to make appointments either with their pediatrician or another supplier of the vaccine.
So we know at major events, some have become dependent on testing, that you have to take an at-home test or a quick rapid test at the entrance and let you know. Is that something, if families wanted to do that, is that something you recommend? Or if everyone tested negative, they can really feel secure?
Yeah, I really think that's a personal decision. There's no formal recommendation on informal gatherings. Obviously, businesses have the right and the ability to require that in areas where people from the public will be mixing with one another. It becomes more of a personal choice in like the family gathering type of scenario. But again, another change from last year, those rapid tests are now available. You can purchase them if it's something that would make you and your family feel more comfortable. It's another tool in the arsenal that we didn't have at this time in 2020.
And for those, I do know a couple of families who are considering it because they've got people coming in and wondering, and I was asked, are they accurate? Like, as long as you have a negative test, can we all relax? And any opinion, if you do decide, if you're going to someone's house and they say, I want you to take a rapid test, can you relax a little more if they're all negative?
Yeah, the rapid tests are not quite as accurate as the PCR tests that you would go to a testing center to get, but they're relatively accurate. I think they give you a strong indication of whether someone might be COVID positive or not.
Now, the tough thing with kids is I know everyone's sick of wearing the masks. They're wearing them at school because they have to, but this is family. They're at home. And if you've got grandma and grandpa coming over and you do have some younger children who don't have, who haven't been vaccinated, let's start there, or maybe they only are going to perhaps get this one shot. What's the guideline for masking?
Again, I'll go back to the CDC guidance. They still do recommend wearing masks in indoor settings. And obviously at the holidays, that's pretty much what we're looking at, unless we happen to really get some fortunate mild weather. So I think every family has to make a personal choice on this. It might come down to whether there's vulnerable people in the family, people with those underlying disease states. If you think about the approval we just got for the booster doses, there's a pretty comprehensive list of people with different disease states that would be at higher risk for more severe cases of COVID. That might be one thing that a family may choose to use as a guide. Again, it comes down to personal choice, but the masking, I don't think that we're going to see the masking guidance change before the holidays. What will ultimately, increase our ability to change the masking guidance is really increasing the number of people who get vaccinated. And remember, children count towards herd immunity. We've talked a lot about herd immunity and increasing that percentage. We haven't had the ability to take that entire population of people between age 5 and 11 and even have the ability to get them vaccinated. So that total percentage of the population, including children that are vaccinated in our state or in any area, we have a new tool starting in probably now in November to really start to increase that number. That's how we have an ability to maybe change the guidance moving forward.
Okay. So you just said that the CDC sometimes rolls things back, and as we get our vaccination up, you might actually see the guidelines. So that might be a reason if people are on the fence still. I think it gets a little trickier with kids, right? Because as even families who've been fully vaccinated, the younger the child, the more nervous they get. What can you say to a mom or a dad right now who's thinking, I have a 6-year-old, I want them to be safe, but I'm a little nervous because they're so young?
I put a lot of faith in the studies. The manufacturers of the vaccine. We look at studies all the time in pharmacy when we're considering new medications to use. And some studies are designed better than other studies. I feel like their studies have been designed very well, thinking about the number of people and the way that they compare the different groups. I think that's one of the reasons why the FDA and the ACIP committee have had a lot of faith in the recommendations that they've made. I think we can safely say that the dosage that Pfizer has recommended is going to give you that antibody level that will protect your child from the COVID vaccine. Side effects, again, there are some side effects, but it's very, very, the incidences of them is very low. We also now have had almost a year of tracking adverse events in the whole population. So we haven't seen anything of major significance come up to date.
So when you say side effects, you're meaning more like pain at the injection site or typical things. But as far as any other, I think that's when parents are nervous, they're thinking of like long-term side effects, or you hear questions, people ask me, how do we know it's not going to give you cancer 10 years from now? Or how do we know down the road? What, from a scientific perspective, what are you saying to parents who are wondering about those kinds of questions?
Yeah, again, nobody can absolutely predict the future. There's nothing about the way that these vaccines work that would cause us to have any concern about a long-term effect like that. They're in and out of your body with in a very short period of time. They do what they're supposed to do. They create those mimic particles that look like the spike protein of the virus, and really it's just it's a harmless particle that just generates an antibody immune response in your system. There just doesn't really seem to be anything out there that I've seen or read that would lead me to believe that there'd be some long-term side effect down the road that we wouldn't know about.
The thing that people do need to know is that what has changed also since last year, when the original stories were coming out and everyone was more concerned about older people, we've seen the people end up in the emergency rooms, the ICUs, and the hospitals nationwide. That the ages have been dropping of people having serious illness. So the idea of like, oh, my child is probably fine, even if they got COVID, we're seeing some people have some pretty serious illness with these new variants who are much younger.
Yeah, there's definitely a randomness to it. I don't think any of us can really say for sure. Something within our systems that, a certain segment of the population just really reacts very violently to the virus. And that's why when I think about it, I think it really is in your best interest to get the vaccine, just to reduce the odds that if you happen to be one of those people that has that serious type of reaction, outside of the typical disease states where I think we can predict it a little bit better. Everything is a risk benefit analysis. And, with the studies we have, and, now that we have millions and millions of people who have received the vaccine, some of them as long as a year, even more than that if they were in the study, I just feel like it's a mounting body of evidence in my mind that the risk is greater. I mean, the reward is greater than the risk.
For getting the vaccine, right? The risk.
Yes, for getting the vaccine.
And, for kids to be able, a lot of schools are allowing kids to not quarantine if they've gotten the vaccine, or, in schools in Connecticut, it's a little bit different. But even in like private schools, you're hearing that, as long as they have the vaccine, then they're not going to have to miss on this. So the return to normalcy will happen faster. Based on what you're hearing, if we get that younger population vaccinated as well.
Right. And, and when we get past the holidays and into January, and, many children whose families decide to proceed with the vaccine get to that full vaccination status, after, 5 weeks, there'll be the opportunity to review those things for even, different age groups.
So just people, I'm sure, are going to hear, oh, wait, we might be able to get at least one shot in by Thanksgiving. And if there's older folks who might be nervous or something like that, that one shot would give some level of immunity to the kids?
Yeah, the immunity after dose one, it's on a slow creep up from, say, day 1 through day 14. I can't say exactly what the immunity level is at different days, but we do know after about day 7, if you think back to the original studies last year, you're starting to have that antibody effect kick in, and, the percentage of coverage just starts to rise up to that really amazing 90 to 95% range that we've seen with these vaccines, which, I like to remind everybody, there's a lot of vaccines out there. There's a flu vaccine every year. We've never had a flu vaccine with a 90 to 95% efficacy rate. We're just incredibly fortunate that the way these vaccines were developed, we're seeing the kind of numbers that we're seeing in terms of protection. It really is extraordinary in the world of vaccines.
And I had the flu shot actually today, so I just reminded me of that. And so you're encouraging
your
people.
arm is sore, I can tell.
No, we get them right here at work at Channel 3. They give them out. So that's something to remind everyone that they should still be getting those other vaccines. I know doctors have been worried about a twin pandemic where, you maybe aren't getting the flu shot, and then they've got a whole problem with flu as well. So you want to be getting both of those. But basically, before we close here, we've talked a lot about Pfizer. That's what's on tap. It looks like it's going to be approved. Does it look like it's going to actually just get the emergency approval, or how long would it take? I think parents say, well, why won't it be fully approved?
We'll see the emergency use authorization first. I don't think they've submitted for the full approval yet. I don't know if the timeline will be any different than it was for Pfizer with the original, which was about 9 months after the emergency use authorization. But that we're definitely looking at an EUA to start with.
Yeah. And if you have people in your family who are not getting vaccinated, and we all know people who have friends or family that say, I'm not doing this, how does that change for gathering at the holidays?
Again, I'll go back to the masks. I mean, I think that your best protection in situations like that is to follow the CDC guidance with the masks. Also want to remind people in talking about masks, I know it's a controversial topic, but it really was amazing last year. If you want to look at the positive in things, there was so little flu around last year. And ask around and ask how many people had common colds last year. The numbers were just infinitesimal compared to what we're used to seeing. Masks are very effective at preventing virus transmission. And I know it's not the most comfortable thing, and I know it's not something we want to do forever, but they do what they're supposed to do. And until we completely get our arms around this virus and get as many people vaccinated as we can, it's our number one tool to prevent spread.
I want to end on a positive note. The latest numbers, we've been seeing them going down. What I've been reading is that perhaps we hit a peak and we're going to go down, down, down. I think people are wondering, like, oh no, is this all going to ramp back up in the winter? What's the latest on trends for this virus?
Yeah, I mean, we're on like a very, very slow downward decline. There likely is going to be some kind of a spike in the winter. Again, a lot of it depends on our behaviors. We control our own destiny in terms of whether we have a significant winter peak. Whether you're vaccinated or masking, those are the things that are going to blunt that spike from occurring. They're going to predict a spike just because we all go inside. It's really that simple. Everybody likes to be outdoors when the weather is nice, and we know that transmission is much lower in those situations.
It's a year to get yourself out there snowshoeing and skiing, right? Enjoy the beauties of New England.
Absolutely. If you enjoy doing outdoor winter sports, have at it. No mask needed.
Eric Arle, thank you so much for sharing the very latest on the holiday guidelines and the timeline for kids getting vaccinated. We appreciate it.
No problem. Thank you for having me.
Thanks for watching Kara's Cures. You can share this wellness information with someone you love, get all the details so your family can plan. You can also listen to this episode on the Kara's Cures podcast. Wherever you get your podcasts, you can subscribe there and watch it again on the Channel 3 streaming app. Follow me on social media at Kara Sundlun for more wellness stories and join my Kara's Cures Facebook group. See you later.